Democratic leaders also addressed the Republican health care plan following their caucus lunch.
Okay, I am proud to be joined by my colleagues, Senator Murray of the Health Committee, Senator Wyden of the Finance Committee, Senator Murphy and Senator Hassan, both members of the Health Committee. Okay, well, last night, the Republicans finally took their health care plan out from under lock and key. Please, folks, can you move back? Enough of this. Thank you. Last night, the House Republicans finally took their health care plan out from under lock and key. Trump Care is finally available to the public, and Democrats, a growing number of conservatives, and millions of Americans don't like what they see, and for a whole host of reasons. First, Trump Care means higher costs for less health care, plain and simple. It means higher costs because the tax credits are far less generous than under the Affordable Care Act. It means less health care because Medicaid is cut and capped, and insurance companies can provide less coverage. Second, Trump Care cuts taxes on the very wealthy while forcing average Americans to pay more. Premiums are going to go up, but Americans making over $250,000 will get a big tax break. It could average as much as $200,000 because it's an average, and the high end pulls it up. And insurance companies making over $500,000 will get a tax cut. This is a tax cut for the wealthy with some health insurance provisions tacked alongside of it. Third, Trump Care raises costs on older Americans and provides less assistance to help them afford the care they need. Seniors could be stuck with only $4,000 in tax credits to help them afford medical care. They'll live one accident or illness away from financial ruin. And because it cuts the Medicare trust fund, Medicare will run out of money now in 2025. Not very long away. Not very comforting for an elderly person in a nursing home or for their kids who might have to help support them. Finally, Trump Care might be one of the biggest assaults on women's health that we've seen yet. The bill reduces coverage for maternity care, for mammograms, for birth control, and more. It eliminates next year's funding for Planned Parenthood, which provides health care for millions of American women every year. So it's no wonder the Republicans kept this plan under lock and key. It's no wonder they want to jam it through before the American people learn what's in it. It's no wonder they want to vote before the Congressional Budget Office tells us how many people will lose coverage and by how much this will increase the deficit. They're ashamed of this plan. And it's amazing to me that after 8 years, they are so ill-prepared that they don't have their act together, and that both from the right side of their party and the left side of their party, people are taking shots at it, if their party has a left side. Now, it's near certainty that this bill will cause millions to lose insurance and blow a gigantic hole in the federal budget. So it's reckless, irresponsible for Republicans to make Congress vote on this mess of a plan before we have those answers from CBO. Simply put, Trump Care is a mess for the American people. We Democrats will fight it tooth and nail. Senator Murray.
Well, there is a lot that could be said about the way this harmful legislation is just one big broken promise to patients and families, but I want to focus specifically on what it would mean for women. As someone who has fought time and time again to make sure that women are able to make their own health care decisions, I've seen a lot of very harmful, backwards efforts. But this Trump Care bill couldn't be a more complete example of a wish list written for and by extreme politicians who want to attack women's health. To start, it would cut off access to critical health services that millions of women and men get from Planned Parenthood. Now, some Republicans may claim that other providers can just simply pick up the slack, but medical experts called that idea ludicrous. Taking away access to care at Planned Parenthood means millions fewer people get STD tests, cancer screenings, and other basic primary care each year. Those are the facts. Trump Care also slashes Medicaid, taking coverage away from low-income women and women of color who disproportionately rely on that program. And by gutting protections and putting the power back into the hands of insurance companies, Trump Care would take women back to the days when insurers got to decide whether critical parts of women's health care were covered, including maternity care, mammograms, and contraception. To be clear, these are not optional benefits. They are essential, and they should be treated that way. Finally, this legislation would make it harder for women to exercise their constitutionally protected abortion rights by discouraging insurance companies from including that in their plans. All in all, this bill undermines women's access to health care and women's ability to make their own health care decisions in virtually every way a piece of legislation could. It is offensive and it is unacceptable. And it sends a deeply harmful message from House Republicans to women everywhere that their health and the economic security that comes with it are a political football rather than a national priority. But I know, and women across the country know, that we are stronger as a nation when women are healthy and in control of their own futures. So we're going to fight this deeply harmful Trump Care legislation because of what it would mean for workers, for families, and for all of us. And I hope that everyone who agrees with me, Democrats or Republicans, will as well.
Senator Wyden.
Thank you, Leader Schumer. And I want to pick up on the leader's point. This proposal is essentially reverse Robin Hood. What you have is hundreds of billions of dollars coming out of the pockets of working people and working families, and it's transferred to the most fortunate in our country. And nothing illustrates that more clearly than the fact that the Republican proposal gets rid of the additional payroll tax on high-income people. Now understand, everybody in America, when they get a paycheck, they have a Medicare tax on it. The only people who are getting a tax reduction are the people who are the fortunate few who need another tax break least. And what that proposal does, and this is particularly striking, is it raids the Medicare Trust Fund of more than $125 billion, number one, and it shortens the life expectancy of the Medicare Trust Fund for 3 years. So I think this is particularly important, finally, because this breaks a clear Trump promise not to damage Medicare. All through the campaign, then candidate Trump, and you saw the commercials, said it was going to be hands-off Medicare. That's not what the Republican proposal on offer does. It gives big relief to the wealthiest in our country, and it's paid for by putting at risk the Medicare program. We're going to do everything we can to fight that. The only other point I want to make, and Senator Murphy will go into this in more detail, is that I think this is going to be a real hardship for older people who have relied on Medicaid for nursing home care. Medicaid now pays about 65% of the nursing home bill, and because of the substantial cuts in Medicaid, I think this is going to nickel and dime care for older people that they rely on, and I think older people in this country are going to end up exhausting their savings, and they are going to be hurt by these Medicare changes. Thank you, Mr. Leader.
Murphy.
Thank you, Leader. Well, Trump Care is here, and you are going to hate it. This is a dumpster fire of a bill that was written on the back of a napkin behind closed doors because Republicans know it's a disaster. They know this is a disaster, which is why they didn't let anybody see it, which is why they are rushing it through without any hearings, without any ability for the American public to take a look at it. If they did allow Americans to see it, Americans would notice that older Americans are specifically targeted for harm in this piece of legislation. Why is that? Well, first of all, the bill allows for insurance companies to jack rates up on older Americans. That will result in premiums going up by $3,000 for the average 60-year-old. Second, because the subsidies are so skimpy, that same individual will have their subsidy cut in half. So do the math. There are going to be millions of older Americans, people on the precipice of Medicare, who are not going to be able to afford insurance. Older Americans are specifically targeted for harm in this piece of legislation. And let's not get started on those that rely on Medicaid. Medicaid isn't just for poor kids and women and moms and dads. It's also for seniors who are in nursing homes. The clock is ticking under this proposal for seniors that are in nursing homes because states will not be able to afford to continue to keep seniors in nursing homes if Medicaid is allowed to wither on the vine as is required under this proposal. This is a disaster of a piece of legislation, which is exactly why Republicans are trying to introduce it and get it off the front pages as soon as they can. And Democrats, and as you've heard, many Republicans are going to stop at nothing to make sure that this doesn't become a law.
Senator Hassan.
Well, thank you. Look, the heroin, fentanyl, and opioid crisis is the most pressing public health and safety challenge in my state of New Hampshire. I am proud that during my time as the governor, Republicans and Democrats came together to pass and reauthorize our state's bipartisan Medicaid expansion plan. Because of Medicaid expansion, over 50,000 people in New Hampshire now have quality, affordable health insurance, hardworking people. And this health insurance critically includes coverage for behavioral health and substance use disorder services. The health care repeal bill released last night would undo that progress. Make no mistake, this so-called replacement plan would end Medicaid expansion, which experts have said is the most important tool available to fight the substance use crisis. The House Republican plan also hurts children, seniors, and people with disabilities with drastic federal cuts to the traditional Medicaid program. It would force states to either cut services our citizens need or to raise taxes. As a former governor, I know full well the impact that decisions in Washington can have on our communities. Repealing Medicaid expansion would severely hurt the ability of those on the front lines to save lives and turn the tide of this deadly substance abuse epidemic. Substance use treatment providers have been clear that if Medicaid expansion is repealed, they will have to significantly cut back on the help that they provide to those in need. To pull the rug out from millions of people across the country who are seeking a lifeline from the throes of addiction is the height of irresponsibility. And we cannot and we will not let it happen. We all agree that there is work to do to improve our healthcare system. But repealing the Affordable Care Act, undoing Medicaid expansion, and cutting and capping Medicaid is exactly the wrong approach. I'll stand strong with the people of New Hampshire and with my colleagues in fighting against this dangerous bill that would pull us backward and hurt our efforts to combat the substance use crisis. Thank you. I'll turn it back to Senator Schumer.
Thank you. And let me thank all of my colleagues for the excellent presentations, which just begin to tell you the problems that Trump Care has.
Why not use this time so that Democrats can outline their own plan on how to fix whatever flaws might exist in Obamacare so that Americans can compare and see the Republican route and your route?
We have said repeatedly, if President Trump and Leader McConnell and Speaker Ryan will say that they have given up on repeal, we'd love to work with them to improve ACA. They haven't done that. And once you repeal large sections of the ACA, you run into the kinds of trouble we've outlined before.
Rod Rosenstein in the Judiciary Committee today, were you expressed your concerns before. Were his answers satisfactory, and what are the next steps?
Look, I think he's a fine man. I was disappointed that he didn't say at the hearing that he would call on a special prosecutor. I'm still hopeful he will. When he looks at the guidelines, it's really the best, far and away the best alternative. And I'm hopeful that a seasoned, unbiased prosecutor like Rosenstein will see that.
Mr. Leader, we hear these criticisms from the Republicans, the Democrats, when they passed Obamacare some years ago, that was done in the dark and night, so on and so forth. When you hear those accusations and you see what their preliminary process is here, contrast those two. What is different about what the Democrats did to what the Republicans did?
It's really like night and day, to be honest with you. We had hearings. Our proposals were vetted out in the public over and over and over again. We had a CBO score, so people would know who was covered. People would know how much it would cost. They're doing none of this. They're hiding this plan, hiding it in every way. Why? It's indefensible. They can't defend it to the American people. I think that they're ashamed of the plan, actually, but they're forced by their ideological precepts and their promises for 8 years that they try to repeal it, and they're stuck. And I do have to say, I am amazed how poorly the reception has been and how poorly prepared they were. You'd think after 8 years they could do better than what they did.
This law keeps in place some of the popular provisions of Obamacare, staying on parents' health insurance until age 26, the ban on discrimination for pre-existing conditions. Do you consider this bill a repeal of Obamacare? Or is
Absolutely. It is a repeal, and it replaces it with something far worse. And I would say this, on the pre-existing conditions, it's unclear. Their original proposal did not have a guarantee of pre-existing conditions being covered by cost. Now I hear they're changing it. We'll see what happens there.
Senator, you said Democrats are going to fight this tooth and nail. Can you explain how exactly you're going to do that? Are you going to offer amendments?
Well, I think our job is to always hold the president and our Republican colleagues in the majority accountable. And that's what we're going to do. I think when the public hears what this plan is all about, they are going to really dislike it. They're going to hate it, as one of my colleagues said.
Are Democrats going to filibuster any legislation that would fund President Trump's wall with Mexico?
Well, we're discussing that issue right now. The wall is both impractical and unpopular, and we would say to the president, why don't you get Mexico to pay for it, not have it take money away from other needed programs? Thank you, everybody.